Hello, my name is Anthony Baloukas. I'm 18 years old and I'm from Montreal, Canada.
My name is Stella. I'm 17.
Hi, my name is QiAnna. I'm 13 from Arkansas.
And Truss, I'm 15.
Hi, my name's Elena. I am 17 years old. I'm from New York.
Hi everyone, I'm Jenny. I'm from South Carolina. I'm 16 years old.
And I have
scoliosis.
Hi, my name's Ashley. I'm 19 years old. I'm from Montreal, Canada, and I have scoliosis. Scoliosis has truly changed my life in so many ways. I was diagnosed when I was 13 and had a spinal fusion in 2010 when I was 14. Going through the spinal fusion and having scoliosis in general has really made me a stronger person today. And having this disease has taught me that scoliosis does not only affect our body, but our mind. I hope after viewing my film, you can really see firsthand what scoliosis is and hear from people who are dealing with it right now in present day, how they really feel about this disease, how they really feel about their bodies, and how scoliosis has changed their life.
It all started when I was 12 years old, a few years ago now. And I was visiting my gran, and she noticed when I was bending down to pick something up, I think, that I bent down a bit weirdly, and she felt my back and she had a look, and then she said I better go check it out at the hospital because she thought it was scoliosis, and it turned out it was.
So around the age of 12, at a regular checkup with my doctor, he noticed that I had a small curvature in my spine.
When I was at my grandpa's house, it was like when I was 9, I was at my grandpa's house. My grand wanted me to try on the dress. I tried on the dress, and then they said, "QiAnna, you're standing weird. Why are you standing like that? Stand normal." And I said, "I am standing normal. You should get that checked out." And so then I got it checked out, and they told me I had scoliosis.
After hearing everyone's scoliosis story, I thought it'd be a good idea to learn more about scoliosis, and I headed over to the Shriners Hospital in Montreal, Canada, to interview orthopedic surgeon Dr. Ouellet.
Scoliosis is a deformity of the spine, and it's a deformity that presents itself almost at any time during their lifehood, more often when they're children. Some children are born with scoliosis, and that's often because their bones have been malformed. Other types of scoliosis is something that presents when the child is about 10 or 12, and it's really when they're going through their growth spurt. And at that time, what happens is that the growth is asymmetrical, so one side sort of grows more than the other, and then you get this deformity that develops. There is no absolute cause that we found. Now, we know that it's genetically based. It runs in families. There are certain types of scoliosis that we sort of know why the child develops a scoliosis. So one of them is a bit what I was telling you about. We call it congenital scoliosis. It means that the vertebrae have been malformed. So why are they malformed? Because there's an error during in embryo that the cells and the bones actually form oddly, and because of that, then you have scoliosis. There's the majority of scoliosis is what we call idiopathic scoliosis, meaning we don't really know what causes it. And these are the ones that are genetic in base. And now there's a bunch of research that have shown that some of the genetic components of it is related to the inner ear. So there's balance that is associated with that. And that there's also some issues that are regarding the type of growth. So sounds a bit funny, but the front of the spine seems to also grow faster than the back of the spine. Because of that, you get this rotational deformity. Third one is what we call neuromuscular scoliosis. So it means that it's related to nerves and muscles. So to give you an example, children that have, let's say, Duchenne muscular dystrophy, this is this muscle condition that causes weakness, they develop scoliosis. Other children, such as a child that has cerebral palsy. That's what a child that has cerebral palsy is a problem with their brain, sending messages to control the muscles. So these children develop neuromuscular scoliosis. So that's the third type. The fourth type is what we call syndromic. So syndromic means that it's essentially a constellation, like a multitude of different conditions, and that you put them together and creates a syndrome. So I'll give you an example, Down syndrome. So a child that has Down syndrome, again, because of their overall sort of constellation, they have a higher incidence of scoliosis. So there's a bunch of syndromes. So there's Marfan syndromes, there's Cri du Chat syndromes, Down syndrome. So there are all these syndromes that have scoliosis. And finally, the fifth type is what we call mesenchymal. So mesenchyme is actually the type of cells that forms muscles and bones. So there's some abnormalities that we know that are abnormalities, let's say, in bone. So a child that has osteogenesis imperfecta, which is a brittle bone disease, have a much higher incidence of scoliosis, and their scoliosis is because the bone collapses. It's brittle, it's fragile, and it breaks, and because of that, they develop scoliosis. I try to teach this to families and sort of expose to them what are the options to manage scoliosis. There's three. It's sort of straightforward. One is that we observe. If the curves are small and we don't think they're going to get worse, we just say, well, we're going to keep an eye on it. The second treatment, if you want, is really bracing. So in a child that has a curve and the child is going to be growing, you need to put them in a brace so that the growth, or you try to control some of the growth to prevent the curves from getting worse. And then when the curves are severe, those are the ones that we recommend surgery. And the surgery really sort of blocks the spine for the time being to prevent it from getting worse. What we found is that if you don't treat it, the curves, and those are the ones that are continuing to get worse, start impacting the lung functions. And therefore, if you leave a curve that becomes severe, by severe, we're talking about 70 degrees, 80 degrees, and so on, then these are the patients that run into trouble with their lungs. So you want to prevent that. The other thing, there's a component of aesthetics. If you think about it, as the spine continues to deform, then the appearance and self-image changes. And a lot of the patients don't like that, and they want to try to become as normal as they can. So it's a bit of a trade-off in respect to if the curves are small, and they have a bit of a clinical aspect, we say, well, listen, you'll have all your function, so ignore it. The ones that we need to treat are the ones that are sort of getting worse and worse, that are going to be getting into trouble with their lungs, and that they're not happy with the way that they look.
Like Dr. Ouellet said, a lot of people with scoliosis tend to have body image issues.
Another big thing with people with scoliosis, they're very self-conscious sometimes. I have uneven shoulders, so that's always hard for me, definitely since I'm a swimmer, and people see it a lot, and they always make fun of it.
I had scoliosis for probably 5 or so years now. Big thing that you can notice is that one of my hips is actually crooked because of this, like the way my curve is, that my hip sticks out farther on one side than the other.
When I grew up, obviously my back did get worse. And at one point I noticed changes in the look of my back. I started getting humps on the top right corner and the bottom left corner of my back. So I have two big bumps that make my back look very strange, which obviously made me insecure at times. Like going to the beach, I had problems taking my shirt off because I think people would notice if they saw my back. I was afraid of what people would think. Even as much as back massages, when someone would give me a back massage, I'd feel so uncomfortable, not only for myself, but for them, because I thought they were feeling this very weird, strange back. Also, the doctor said that this also has a few inches off me in height, so I was pretty upset about that. I also was very insecure about my height growing up. I wanted to be 6 feet, which is what I was supposed to be, but because of my scoliosis, it had about 2 inches off me, which really sucked.
Surgery to correct scoliosis is always on the minds of those who deal with the disease.
Scoliosis surgery is a major surgery. Patients typically are in hospital for about a week. The surgery itself, depending on how severe the curve is and what needs to be done, can take up to, let's say, 3 to 6 hours. During the surgery, the main goal, and this is sort of the standard treatment, because there's now new technologies that are coming through that are coming out that may alter the current way that we're treating them. But the standard way that we treat scoliosis is that what we want to do is to be able to prevent the curves from getting worse. So we have to create a bridge, and it's a bony bridge between each vertebra. So the little blocks of the spine that are the vertebrae that are now sort of all deforming slowly, we want them to become one piece of bone. So the way that we do that is that we make an incision in the back, we move the muscles away from the spine, and we get onto the bone. And then we scrape every vertebra. So we're almost creating little fractures at each vertebra, so that when the body heals, each vertebra will heal with the one that's beside it that's also been irritated or fractured. So then all the bones, or all the vertebrae that you've opened and sort of caused the fracture will all heal as one piece of bone. And then we used to put patients in casts, that were from their chin down to their toes for like 9 months, couldn't walk. So instead of doing that, what we do is that we put in screws. So we're putting some anchors, so spinal anchors. And these, to a certain degree, I could even sort of show you on the model. So this is a model of the spine, so that we place these little screws that allows us to attach a bar. So the bar, we use a pencil as the bar. But then we create this construct that allows us to sort of attach everything together. And it's a bit like when you break your leg. The bars are there to hold the spine into place so that when it heals, it all heals together. The bars we tend to leave in, but to a certain degree, that's not what counts. It's really that all the bones become one. So the rod, as we go, we sort of want to correct the deformity, so we attach at the bottom, and then as we attach all the screws and rods, and the spine sort of straightens out. There's the immediate period where they have a bit of pain, so their mobility is a bit diminished, but fairly quickly. So within the second or third day, we're getting them to get up, to stand, to sit, and start walking. They go home and they're walking. They're going home, they're going up and down stairs, going to the washroom on their own, getting in and out of bed on their own. For the first 3 months, we don't want them to, it's almost like we don't want them to walk on a broken bone. So what we ask them, they're allowed to do regular activities, but no sports. So they're allowed to walk, but we don't want them to run. So it's only really after the first 3 months that we want them to start being active. So at 3 months, they're allowed to start swimming. At 6 months, they're allowed to start running. At a year, they're almost allowed to do any type of sports other than contact sports. And then after 2 years after the surgery, everything is nice and solid. They can do whatever they want.
It was actually 2 operations, which I knew nothing about. I thought it would be maybe a week in hospital and an operation, but I was very wrong. First operation, which wasn't on my back, it was on my side. They had to take out a lot of fluid out of my chest through a tube, so they took out some of my rib, and then there was like a tube that led into a bucket on the other side of the bed, which was a bit weird, and that was just draining out of me for the week, and it ended up looking like juice or something. But that was hell. And then I had my last operation in about a week and a half after that, and it might sound a bit weird, but the more serious, longer operation, which was the back operation, was less painful than the smaller, less important, really. I'm just so lucky it went right.
My surgery coming up soon. Well, probably soon. It's 162 days. With that being said, guess I'm gonna be nervous. I'm gonna have fears.
I never actually had surgery on my back, but I've been seeing a doctor for a while, and I feel like my curve has gotten worse. Right now, I feel like I'm at the point where people have mainly gotten surgery when they have scoliosis like mine, but I am just going to live with it for the rest of my life because this is just how it's been for a while.
I still have to go check up with my surgeon every so often to see if I do need a surgery because I'm at the 45 degree. And 50 degree is the limit. After 50, usually you need surgery. So I keep going to check up to see if it gets worse. So far it hasn't, so I don't need the surgery. I really don't want the surgery. It's a big procedure. So I'd rather stay with the uncomfort of the way it looks rather than getting a whole surgery, which could stop me from doing certain activities that I would like to do in the future.
Pain is also a huge part of dealing with scoliosis.
We've recently done some research here, and we found that actually there's about 50%, half of the patients that have scoliosis actually complain of some amount of pain.
If we describe scoliosis in a word, it'd be pain because it hurts a lot.
Some issues that I would have is that my back, if I'm standing for a while, will hurt more. If I'm wearing heels, especially, my back tends to hurt because of it, and it gives me a lot of pain.
Despite the small curve, my pain is still pretty bad for how small it is. I have to use this thing called a TENS unit because it hurts so bad. So and I take Aleve and all that medicine a lot.
They ended up giving me a back brace. The problem is you basically have to tighten it with Velcro straps in the back as much as you can, which made it very uncomfortable. It was painful to wear at night. I had trouble breathing. It wasn't fun.
But at the end of the day, scoliosis does not define us, it only makes us stronger.
I don't really pay attention to having scoliosis on a daily basis because it's not something that controls your life. It's just something you live with.
A few years later, I'm back to being a goalkeeper for football.
Everyone has something wrong with them. Yours just happens to be scoliosis.
Scoliosis is a deformity, not a disease. So we can get through this. We are Scully strong.